Thank you for joining us for today's ASPPH Presents webinar, Association of Schools and Programs of Public Health and the Community Guide, Partners in Public Health, co-sponsored by the Center for Surveillance, Epidemiology, and Laboratory Sciences in the Division of Public Health Information Dissemination at the Centers for Disease Control and Prevention. This webinar is part of the ASPPH Presents monthly series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation, but may address a few burning questions throughout the webinar. This webinar is being recorded and it will be available on the ASPPH website soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our speakers today are Mariette Morano, a fellow with CDC through the Oak Ridge Institute for Science and Education. Ms. Morano earned an MPH with a concentration in health promotion and behavior in May 2015. The evaluation of how ASPPH members use the Community Guide was her capstone project. Ms. Morano started as an intern, became a fellow with the Community Guide branch, which allowed her to complete the data collection for this project, and recently transitioned from the Community Guide branch to the Division of HIV/AIDS Prevention. Anita Alston Ellis is a postdoctoral ORISE Fellow on the Dissemination and Implementation team in the Community Guide branch. Her primary role is supporting the dissemination and implementation of findings of the Community Preventive Services Task Force. Dr. Ellis led the analysis of the ASPPH data and has worked at CDC in various public health positions since 2001. Kathy Wilson leads the dissemination and implementation team of the Community Guide branch, where she oversees the growth of methods, tools, and training for providing technical assistance in accessing and applying findings from the Community Preventive Services Task Force as found in the Community Guide. During her 25 years at CDC, she worked with communities to use evidence-based interventions. Thank you all for being here today.
Thank you, Sarah. We appreciate that. We are glad to be here. You'll see now the disclaimer slide. That is our standard slide when we present for CDC. Moving to slide 6, we want to recognize some individuals at ASPPH who were very instrumental in getting these data collected and as task force liaison representatives to the Community Preventive Services Task Force. Now, just to practice a bit, because we'd like to make sure we can all use the technology, we have 2 poll questions for you, and I believe Sarah's going to help me with this. The first poll, you'll get 5 seconds to answer. Which picture most closely matches your weather this past weekend? Oh, we need the do. Forgot the music. Umbrella, 1. Okay, good job. For the second question, are you familiar with the Community Guide? Again, 5 seconds. Easy one. Wow, that's really encouraging. 72% of you online right now are familiar. I am very happy to see that. It's usually flipped around, so I appreciate you answering. Hopefully, we're not going to be too repetitive, but I would like to take just a minute and go over in a broad sense, if I can get the slides to switch, thank you, what the Community Guide is, what it does, etc. And if you have been looking at the communityguide.org, you'll see it's a repository of all of the judgments, be they recommendations for or against, or a finding that has insufficient evidence to say whether or not it can be recommended. These are from the Community Preventive Services Task Force. I briefly just want to talk about some other things that are there, talking about strategies, going to programs, help you understand the uses of the Community Guide that we have seen and perhaps talk about some of the dissemination implementation challenges, some of which I think might resonate with you all. If you've been to the community guide, you'll see that we talk at a high level. The Community Preventive Services Task Force looks at an intervention strategy aimed at doing a particular or having a particular outcome. For example, the top one in this slide looks at reducing obesity as the aim. One of the strategies they've looked at is behavioral interventions to reduce screen time. On the website, you'll find the elements that define that intervention, and you'll find a description of the outcome that they want and the effect size that the interventions had as a group. But you won't find a prepackaged program representing that intervention. And there's a reason for that. It's important that we don't talk about prepackaged interventions and stay at a high level, because there are wide variations from setting to setting and in how public health interventions are implemented through time. So the task force is able to evaluate whether the effectiveness is influenced by these variations in intervention characteristics, settings, and populations. And it gives more information to users in the review and in the web intervention summary about when the intervention will work in their situation. In essence, the community guide, therefore, tells us what works, because the Community Preventive Services Task Force says what works, but they don't tell us how to do that. So while the community guide doesn't contain the prepackaged program, it assists users when possible getting to other resources that provide that information. Another example is the aim of increasing physical activity. One place we are that is really common for an intervention to link is the research-tested intervention programs on Cancer Control Planet, and you will see those in that second one, especially the Stairwells to Health. But not everybody comes to the community guide wanting to have prepackaged programs. Some people come for other uses, as depicted in this slide. Over time, we have asked numerous groups, including our task force liaisons, representatives, their constituents, state and local health department staff, CDC project officers, and others like yourselves, how they use the findings in the community guide. Over time, we've distilled them into these 11, plus the ubiquitous other at the very bottom there. I'd be interested in knowing at some point in time if when you use the community guide, it has another category of use, something that doesn't fit here. As you can imagine, if these are all the uses, the diversity of users must be pretty great. And in fact, it is. It's everyone from a local community-based organization to state, national organizations, of course, academics, other researchers, funders, and those that want to institute a policy to improve the public health. It is, in fact, that diversity of audiences that presents a number of challenges for us in dissemination and implementation. One size does not fit all. So to address that challenge, we undertook a revision of our website, since it was our primary mechanism to disseminate information from the Community Preventive Services Task Force. If you start at the upper left, you'll see phase 1, which was a proof of concept, and that was done in fiscal year 12. We have since gone around clockwise in each of the following years, building an infrastructure that we hope you will find useful. The core functionality of this is that it's an intelligent search. So just like Amazon, it's going to bring you things you've said you liked. If you type in a search name, those things will appear for you. Hopefully, that will help you spend less time on the website searching for things you need. You also have an opportunity to register and create a profile. In doing this, you further fine-tune what you want. And like Pandora, if you don't like what you find, you can not like it, thumbs down, and it will continue to bring you things that it thinks you might like as well. The third segment engagement is what we just finished doing, and we hope to release that version very soon. We have landing pages for particular segments of the public health audience and our user audiences that we hope will help them find information they're looking for. And there's another tool called My Guide. It's not a navigational tool. It's a set of steps for each of the uses and users associated with that helps people new to the community guide think through the kind of questions they need to answer. Where it is possible, we have information from the website to help guide them to answers. The last segment, which we're in right now in this current fiscal year, is system integration. And here we hope to have some more connectivity among and between folks like you all who are instructing, using the community guide in classes, or doing research based on the community guide, what's in the community guide, and hopefully increase the interface with big data sets. For example, Healthy People 2020 and the community health status indicators. By doing so, again, we hope to improve your user experience, and we've been told that these are things people would want, so if you at any time want to be part of usability testing, please let me know your name and we'll call you in the future. Let me show you just briefly, let's see if I can do this now, navigate to live, some of the beta test on the site that's up right now, which is really the end of phase 1 that you saw. This is our current site. It is also called the legacy site, and hopefully it will be retiring soon. But in the meantime, I encourage you, even now if you have 2 screens, to click on this Explore, the new Community Guide beta site button. And you'll see an example of a home page. This scrolls, as you can see, and you can click on it to find the information that's being featured in that teaser box. You can also, moving up to the top right, search for a particular review that you might want, just for an example. And by the way, you don't have to spell it right. It corrects it for you. It also has a drop-down menu that says, what about diabetes would you like to see? If I just pick diabetes, the reviews that are related to diabetes will show up. This is our latest review. Right now they come up in chronological, the most recent and descending. And so this review, if it is of interest to folks, you can go click on it, find out what the definition is, what the percent effectiveness they found, any economic evidence that is there, and also insufficient evidence gaps that were identified within the studies that were used in the systematic review. Briefly, across the top, you'll see there are 46 systematic reviews that have something to do with diabetes. There are 6 in-action stories. These are stories of how communities, states, health departments, businesses use a finding in the community guide in a particular effort, and this is just their story. Tools, there are 2 related to diabetes, and resources. Again, you see there are 4. Tools and resources here are split specifically. Tools have actions you take either by completing something, going away doing a task or an activity and coming back completing. A resource is simply information that you can read and could be really, really helpful, but it is not an action item. Going back, clicking on the design element at the top takes you back to the home page. I just want, lastly, to point out a couple things. Everyone gets the same information, even if you don't register or create a profile. So everyone would see most viewed and the recently updated columns that are on the home page. But if you register, you get 2 more. Again, like Amazon, people like you also looked at, and you might also like columns come up. And so you are, the system refines to what you want the amount of information you get and the topic of that information. So that was a quickie tour, and I'm going to go back to the slides and look at, sorry for the delay here, and turn over the presentation to Mariette, who will talk about the feedback you all gave us in the recent survey.
Thank you, Kathy. I will now present the purpose and methods for gathering feedback from ASPPH members, followed by Anita Ellis, who will present the results and recommendations. As public health professionals, we know evaluation is integral in improving our programs, products, and interventions. The Community Guide Branch Dissemination and Implementation Team partnered with ASPPH to investigate and evaluate its use among ASPPH members. This partnership is so important because this has been a joint information gathering mission. Partnership makes progress in public health possible. This pilot has paved the way for future information gathering with other task force liaison organizations. We wanted a quick and easy way to reach this audience. Not only is it important as a task force liaison organization, but this organization speaks to the sustainability of levels of the use of the Community Guide. Students learning about the Community Preventive Services Task Force and the Community Guide as a part of coursework are likely to draw on this in practice. Our sample included instructors whose coursework was primarily in the areas of social and behavioral health and health policy management. We gathered this information from each school and program's website. Each school and program shares information about coursework differently, so we organized instructor emails into these two groups and tracked their responses separately. The first group is targeted by the coursework they list as teaching, and the second group was more general. We did not include schools or programs whose website was not in English. The number of individuals who ASPPH sent an email invitation to complete the survey was 1,307. Because neither we nor ASPPH knew how to yield the best response rate, we tried a few different approaches. ASPPH sent emails directly to both groups of instructors whose information we gathered from their websites. We also asked Associate Deans for Academic Affairs to send the link to instructors directly in hopes that it would encourage and motivate them to participate. ASPPH also included the survey in their Friday newsletter. The survey link and email were also forwarded by an individual who uses the Community Guide in their coursework to their colleagues. Each group of participants were tracked separately through a unique survey link. Designing the questionnaire was a fun and collaborative process. We started with the evaluation questions we wanted to answer and worked from there. Several of the questions were consistent with previous Community Guide branch surveys, and several were developed for this evaluation specifically, questions that both the Community Guide branch and ASPPH wanted to answer. We cognitively tested each question with 13 individuals who were both involved in public health education or instruction and familiar with the Community Guide. Since this is a joint information gathering effort and the surveys were being sent directly to the instructors by ASPPH, we sought approval from their Data Advisory Committee on the final version of survey questions, as well as the analysis plan to ensure that appropriate and high-quality questions were being asked and that the results would be put to good use. Cognitive testing or interviewing has been commonly used in pre-testing surveys before they are disseminated to a larger audience. Cognitive interviewing is useful because it helps to clarify any aspect of the survey that might have been misconstrued by the respondent. To gain knowledge of how the interviewee comprehended each question, we asked what they believed the questions were asking and what specific words or phrases meant to them. After all interviews were completed, they were coded and analyzed for common themes, and based on that analysis, recommendations for changes were made. Here is an example of our process. You can see the original question, a summary of the feedback, and how we incorporated those suggestions in the final version of the question. As I mentioned before, of the 1,307 emails that were sent out, 21 were returned because they were either undeliverable, duplicates, or the individuals wanting to be removed. This left a total of 1,286 surveys sent directly to instructors. This number does not include the individuals who saw the ASPPH Friday newsletter or those who received the survey link from the personal listserv. In total, we received 169 completed surveys. The survey was available for 10 weeks, and as you can see in this visual, we were the most successful when we sent emails and reminders directly to instructors. We asked instructors how many students were in their school or program, both in the undergraduate and graduate levels. We were happy to see responses from each size of schools and programs. Many responded that there were 500 or more students, which is encouraging considering we want as many students as possible familiar with the community guide. As we expected, of the 169 respondents, the majority instructed a course in social and behavioral health discipline. Now I'm going to turn it over to Anita, who will present our findings.
Thank you, Mariette. So 72% of you guys on the phone are familiar with the community guide. That's very similar to the 70% of respondents who were familiar with the community guide that actually took the questionnaire. Of the 118, 63 respondents, averaging about 53%, learned about the community guide via the community guide website. So that's about 53 of those who answered the question. Other ways reported that the respondents learned about the community guide were via the Cancer Control Planet, Surfing the Web, Nacho, APHA, and as a student. As you may see, developing questions that explain how ASPPH instructors use the community guide were essential. This slide reveals that 57% of the respondents had shared information about the community guide with their students, and 40% of the respondents with at least one colleague in their department. This bar graph shows data on how respondents present information about the community guide to their students. The first two responses displayed on the bar graph reveals that the two main ways information is presented is via lectures and provided as a resource, both averaging about 37%. We also asked if students were required to use the community guide for class assignments. 50% of respondents required students to use the community guide for class assignments. As previously stated, the percent of respondents who were familiar with the community guide was 70%. As expected, ASPPH respondents had used the community guide more so to educate about systematic reviews and also to foster dialogue, as opposed to GovD and state territorial directors whose use for the community guide was different. GovD respondents have used the community guide to plan individual interventions and to develop overall program strategy, which leads us to believe they may be program or project managers. State and territorial directors often are mandated to use the community guide findings and recommendations as a part of developing overall program strategies. This effect is shown here in our findings. To develop the overall program strategy was the highest reported way state and territorial directors. Sorry about that. So this slide is animated. We'll give you a second to read here, but I'll continue to talk about this slide. Here we thought it would be useful to show some of the quotes from the respondents on how students use the community guide. Other examples included health initiatives on campus, grant applications, and community coalition on bicycling trails. One prominent theme was education and community involvement. Another prominent theme was unsure about how to use the community guide in their course. So now we will begin with our poll question number 3. What could be provided to increase the awareness of community guide in schools and programs of public health? Check all that apply. We'll give you about 5 seconds. Oh, wow. Okay. Teaching tools. Is that a new area? Okay. 79% webinars. Okay, so these are your results. So this is how it compares to the group that responded to the survey. Maybe. I think so. Yeah. There we go. Uh-oh.
Oh, too far. Sorry.
As you can see, 38% wanted to have, of course, webinars compared to workshops at conferences, 30%. Teaching tools was lower, however, you all reported that you all would really, I think, appreciate the teaching materials. So thank you.
Okay, next question.
So this will be our final question, our final poll question. And we'll give you 5 seconds to answer this. The community guide is considering a repository for class activities which use this resource. The survey says yes. Awesome. So based on popular demand for a repository with class assignments, we will be exploring the possibility of rolling out a repository with activities that may be useful for your students. This is the 75% of course that responded to the questionnaire. They were interested in the repository as well. We appreciate those that took the time to complete the questionnaire, which allow us to assess the sample of ASPPH members' use of the community guide.
The next steps for us are to continue working with the Association of Schools and Programs of Public Health, as well as exploring a bit more how we might use the repository or structure it for your use. If any of you are interested in being on a very time-limited work group to give us feedback about how that kind of repository might be set up, I would very much appreciate hearing from you. That can be done through Sarah, just giving us a name and an email address to contact you in the future. We also, because through the survey, heard that there was interest in workshops, want to explore what kind of workshops might be needed, whether or not they would be regional, how that would be done. Again, we would value your input for that kind of group. We are intending to gather more information from our other task force liaison groups as we go on and put this all together into some sort of final document. But with 30 organizations, it's probably going to take us more than a year to survey all of them. And we do appreciate very much your attendance and your feedback on the survey. And I'd be happy to take questions. Again, if you're interested in participating in any usability test, then just pass your name and email forward.
Wonderful. Thank you, Mariette, Anita, and Kathy. We are now going to take this time to address questions. Please submit your questions by typing them into the question box. The first question is, how could I use the community guide for research grants?
Good question. I don't know, can we still go back a slide to go to the internet? I can show you some places.
Oh, sure. Let me bring that up for you.
Okay, good. Oh, thank you. And then I have it. Wonderful. Let's go to, oh, by the way, if you're still old school and just want to go by the topic, you can do that at the middle of the page. Let's look at the diabetes example that I used earlier. If we go to the Combined Diet and Physical Activity Promotion Program to prevent type 2 diabetes, as it loads, maybe it's thinking about loading. There will be a section that's called Evidence Gaps. Each of the reviews is segmented in a standard form. And across this top part, you'll see there's a snapshot, what the task force found, supporting materials, and considerations for implementation. In the snapshot, the task force finding and the intervention definition are featured, and those are really important to identify the elements in the intervention strategy or the intervention approach that were looked at, and frankly to compare any intervention you would like to put into a grant to. If you have these elements, then you are meeting the evidence in this recommendation. If, however, you are wanting to do something else, you might go to the evidence gap section under what the task force found. Here is a list of the gaps, the things that were not found and that do need research to complete. Depending on what your interest is in an effectiveness review, this first grouping identified evidence gaps for the efficacy study could be of interest to you. Second, if you're an economic researcher, the second grouping of items might be of interest to you. And by submitting the research proposal with the fact that these are identified gaps in the evidence from this website and the Community Preventive Services Task Force, we have found that it strengthens applications because funders want to know that you have looked at the landscape and found where there is a gap for those, if that's the kind of RFA that's out.
Great, thank you. I feel like that'd be very helpful. Another question, you did mention that you are interested in providing workshops. Can you expand upon that a little bit? Like what type of workshops could you provide and how would that be of use?
Sure. You know, in a way it's up to the definition of ASPPH constituents. I could see regional workshops that were using sort of a train-the-trainer approach. I could, in their format, the audiences for workshops could not only be instructors but students, especially master's or doctoral students who want to build research on an evidence-based finding or a gap that's been identified. Another way to look at content for the workshop might be in developing an intervention, or rather selecting an intervention for use locally, because I know many of you have academic community partnerships. There are some guidelines around looking to the community guide for what is there, understanding what your audience needs and what your purposes are, and then selecting the best match. Always a topic of concern is how much do you adapt and not change the intervention. And while the science isn't of one voice, shall we say, at the moment, there are some guidelines from the different practices that you can follow to at least have a standing for adaptation or have a rationale for the adaptation. So it could, the workshops as defined by you all could vary by format, by delivery method and site, and by content. Wonderful. That's great.
Trying to see if there are any other questions here. When will the beta site go live and replace the site that's currently in existence?
We are hoping the phase 2 beta will be out by January. We're having a few technical glitches. CDC does not run on the same platform as our wonderful new site. Our new site uses Drupal and Solaire, which are also used by whitehouse.gov, NASA, and several other .gov agencies, but not cdc.gov. So our security scans are running into a number of glitches. They're Microsoft-based, and Drupal is not Microsoft. So as soon as we get those scans cleared up, I am told that will be our green light.
Oh my goodness, that sounds lovely.
Right.
Let's see here. Why workshop already is indicated how this could. Also, what do you plan to expand upon any of the genres or topics that you already have included in the community guide? Do you have plans to expand upon it, or is it pretty much complete in that respect?
Oh, it's not complete. In fact, the task force just underwent a prioritization process in June of this year, and a number of new items came up. I haven't got that final list in front of me yet because I don't think it's got the blessing, but there were a number of new areas. I do remember one being prescription drug overdose. That was had a lot of support underneath it. Not sure where it landed at the end, but that, I think, sleep habits too. There were a number of kind of new things, as well as some topics or some new facets of old topics, if you will, that we just haven't gotten out there. Childhood obesity is one thing that's a new review we're doing right now. So they will change over time.
Fantastic. Well, I look forward to seeing those, and I think everyone does as well. I just thank you for joining us today, and thank you to our speakers, Mariette, Anita, and Kathy. And Kathy, that is Kathy's email if anyone would like to contact her directly about being part of the usability study. I know I got a few indications in the questions to join. Please also be sure to contact us with any additional questions. And as a reminder, the recording of this webinar will be available on the ASPPH website soon at the address on your screen. Additionally, please register for the next webinar in the ASPPH Presents series. We have one on policy advocacy and the missions of academic public health on December 17th, and one also presented by CDC, the Public Health Associates Program webinar on December 18th. And more information about those is located on the events page under the category of webinars. Thank you all for joining us today, and thank you again to our speakers. Thank you.
Bye-bye.